My name is Jonathan Scull and I'm a consultant gynaecologist and the clinical lead at Jessop Fertility in Sheffield. Since the start of the pandemic, many people who come to the clinic ask whether or not they should have the COVID-19 vaccine and if it's going to have any impact on their fertility. What are the risks of COVID-19 in pregnancy? So as with any medical treatment, it's important to weigh up the risks against the benefits, and the first thing to consider is whether catching COVID-19 in pregnancy puts you at greater risk of serious illness. We know that most women who are pregnant and catch COVID-19 fortunately don't have a serious illness. However, some women can get life-threatening illness from COVID-19, particularly if they have underlying health conditions. And in the later stages of pregnancy, women are at increased risk of becoming seriously unwell with COVID-19, with an increased risk of needing hospitalisation or ventilation. COVID-19 infection can also affect the pregnancy. In pregnant women with symptoms of COVID-19, it's twice as likely that their baby will be born early, and this exposes the baby to the risk of prematurity. A recent study has also found that pregnant women who tested positive for COVID-19 at the time of birth were more likely to develop preeclampsia and more likely to need an emergency caesarean section, and their risk of stillbirth was twice as high, although fortunately the actual number of stillbirths remains low. Recent data showed that 98% of pregnant women admitted with COVID-19 were unvaccinated. So vaccination is the best way to protect against the known risks of COVID-19 in pregnancy for both women and babies, including admission to intensive care and premature birth. It may also potentially reduce transmission to vulnerable household members. So what about the risks of vaccination, and is it safe in pregnancy? We can be reassured that there's very good data to show that vaccines are both safe and effective to use in pregnancy. Real-world data from both the USA and the UK on the use of mRNA vaccines such as the Pfizer and Moderna vaccines have not raised any safety concerns in over 200,000 patients. Vaccines do not contain any ingredients that are known to be harmful to pregnant women or to a developing baby. The COVID-19 vaccines that we're using in the UK are not live vaccines, so they cannot cause COVID-19 infection in you or your baby, and the vaccine does not cross the placenta to the baby. Other non-live vaccines such as the flu vaccine and the whooping cough vaccine have been used safely in pregnancy for many years. Studies of the vaccines in animals have also shown no evidence that the vaccine causes harm to a pregnancy or to fertility. The vaccine can be given at any stage of pregnancy. Some women may wish to delay the first dose until after the 12 weeks, which is the most important time for the baby's development. However, there's no evidence that delaying is necessary. So, if you're currently pregnant, it's advised that you consider having the vaccination, as you can be reassured that it is both safe and effective. One dose gives good protection, but 2 doses are required to give maximum protection against the newer variants. What if you're thinking of having a family or about to have fertility treatment? Given that we know that vaccines are safe and effective, it is recommended that you get vaccinated before pregnancy to give yourself the maximum possible protection during a pregnancy. I'm often asked, can the vaccine make me infertile or reduce my fertility? There is no evidence to suggest that COVID-19 vaccines will affect fertility, and there's no biologically plausible mechanism by which current vaccines would cause any impact on fertility. Animal studies done on the Pfizer and Moderna vaccines have shown that administering these vaccines in rats had no effect on their fertility. There is no evidence that women who have been vaccinated have gone on to have fertility problems or have a lower chance of pregnancy with IVF treatment. Likewise, the theory that immunity to the spike protein could lead to fertility problems is not supported by evidence. Most people who contract COVID-19 will develop antibody to the spike protein, and there's no evidence of fertility problems in people who've already had COVID-19. There is no evidence that the vaccine has an impact on sperm or egg production. If you're a man and have been unwell due to COVID-19, particularly if you've had a high fever, this may have a temporary effect on your fertility, as we know that any serious illness can lower sperm production for a few months. So getting a vaccination will reduce the risk of you getting ill and this having an effect on your fertility. So, can you have the vaccine during IVF treatment? The answer to that is yes, you can have the COVID vaccine at any stage during your IVF treatment. The British Fertility Society recommends that you consider the timing of your vaccine. Some people may experience minor side effects in the first few days after vaccination, so you might want to avoid having the jab around the time of other procedures, such as your egg collection, so that any symptoms you get, such as a fever, may be attributed correctly to the vaccine or the treatment procedure. So what are the take-home messages about the vaccine and fertility? COVID-19 infection can be severe in pregnancy, with a higher risk of complications for both you and the baby. Vaccinations are effective at reducing the risks of COVID-19, and vaccination has been shown to be safe in pregnancy. There is no evidence that vaccination can affect your fertility. Where can you get more information? So I hope this information was helpful, and if you'd like more information on the vaccines and pregnancy, there's some really excellent resources on the websites of the Royal College of Obstetricians and Gynecologists and the British Fertility Society.